thank you guys for joining me today for our series on acid reflux and heartburn. And in the prior lectures, we talked about, how we diagnose it, some of the lifestyle things that you can do. And today I'm going to talk about some of the medical treatments that we can offer you to help out with your heartburn and reflux, and some of the things that you can do to get your reflux better controlled. So as a recap, let's talk about what we define heartburn is. And so when we define heartburn, we say that's the actual reflux of gastric contents from the esophagus from the stomach into the esophagus, causing troublesome symptoms. And the typical symptoms for heartburn includes actually burning in your chest. So when you feel the burning in your chest, that is actually heartburn. Or we have regurgitation of food or saliva or acid going up into the esophagus, causing symptoms as well. So those two symptoms, actually burning your chest or regurgitation, are the typical symptoms for reflux or GERD. But some of the atypical symptoms include things like chest pain, hoarseness, cough, asthma, or globus, or the sensation of something in the back of your throat where you have to keep on swallowing. And some of the other associated symptoms with acid reflux include things like indigestion, pain, bloating or belching, and nausea. So you actually may have heartburn or GERD, and your symptom may just be bloating alone. You may not even realize that. So keep in mind, heartburn can present in a lot of different ways, but the classic symptoms include burning in your chest or your esophagus, or regurgitation. Now, there are a lot of risk factors for heartburn, and the most prominent is obesity. By far, obesity is the biggest risk factor for GERD or reflux. It has a high risk for not only the symptoms of acid reflux, but also the complications from this as well. But other things that can make acid reflux worse include things like a hiatal hernia, medications such as blood pressure medications, pain medications, or anti-anxiety medications, and also pregnancy as well. The way we diagnose heartburn or reflux is that if you have the typical symptoms of heartburn, including burning in your chest or regurgitation of gastric contents, that are typical symptoms, and we can say, yes, you have heartburn or acid reflux, and we can be very accurate in the diagnosis. And for those patients, we can start them on empiric therapy and to see their response. However, we have to be careful of certain things called warning signs, and these are things that you have to be aware of that could be a sign that something else could be going on. And these include things like symptoms over the age of 50 years old. So you have new onset reflux or heartburn over the age of 50 years old. You have difficulty or painful swallowing, or things get stuck as it's going down, or hurts when food goes down. If you have significant nausea or vomiting, you have weight loss, you have bleeding or iron deficiency anemia, or your blood count is low, or if you get full very, very quickly, or you're not eating as much as you used to, these are warning signs that something else may be going on. And for these patients, we may want to jump pretty quickly to do an upper endoscopy or an EGD. Now, some of the lifestyle things that we can do to help out with reflux are to avoid certain triggers that open up the valve between the esophagus and stomach. These include things like alcohol, high fatty foods, tight clothing, increased waist size, or being obese. These are foods or conditions that will open up the valve between the esophagus and stomach, called the lower esophageal sphincter, to make that sphincter open longer and more often to cause acid reflux to occur, to produce patient symptoms. But some of the other things that people can do in terms of lifestyle to help out with your acid reflux include weight loss. Weight loss, by far, like I mentioned before, is the most effective way to help out with your heartburn or reflux. But you can elevate the head of the bed, you can avoid late night meals, and you can also avoid some of the trigger foods that for some patients can typically cause reflux symptoms to occur, include things like chocolate, caffeine, alcohol, or acidic or spicy foods. So now that we talked about some of the things that you can do lifestyle to help out with your acid reflux, what can you do if these things don't work? What are some medications you can be put on or you can try to help out with your reflux? And the first thing I would talk about is antacids. Antacids are available all over the United States. They're available at any pharmacy or grocery store, and they're all available over the counter. And they're very effective for short-term relief for heartburn symptoms. So I see a lot of patients who take Alka-Seltzer or Tums or Rolaids or Mylanta to help out with their acid reflux symptoms. They're all very effective for minor symptoms of heartburn or reflux. They work very fast. They last for about 1 to 2 hours, but they have their own side effects. They can cause diarrhea, and some of the antacids, including those that contain calcium or aluminum, can actually cause constipation. Now, if you find yourself popping Rolaids every single day or every couple hours, make sure you tell your healthcare provider, because something else could be going on within your GI tract that needs to be evaluated. So they're very effective for short-term minor reflux, but if you want to have long-term relief, or if you're taking these medications more and more often, you may need to either bump up the treatment options or at least speak to your healthcare provider about what options are. So this is the first line of treatment, are the antacids. The second line of treatment are what are called the H2 antagonists. You may be familiar with these because they're also available over the counter. The These include things like Tagamet, Pepcid, and Zantac or Axid. They're all very effective. They work short-term. They work longer than the antacids, typically for 6 to 10 hours. They're all very cheap. They're all available over the counter as well, which is why a lot of people end up taking these. Now, the good thing about these H2 antagonists is that they don't have the same side effects as the acid-reducing medications like Nexium or Dexilant. So if you're concerned about the side effects from the PPIs, these H2 antagonists don't have those, but they have their own side effects. For long-term treatment of acid reflux, these typically don't work. More often than not, usually after 6 to 8 weeks of consistent therapy, a lot of our patients will lose the effectiveness of these H2 antagonists. They don't work for long term. And only about half of the patients who have classic reflux actually respond to the H2 antagonists as well. And so don't be surprised if you take it and if the response wears down or if you don't have complete relief, maybe because these are not the most effective options that are out there. And they have their own drug-drug interactions as well. And so keep in mind, the H2 antagonists can affect some of the other medications you may be on. Now let's talk about the PPIs, or the gold standard. These are the most effective medical options for heartburn or reflux. They are the gold standard. They're the medications that end up working the best and are the most effective. These include things like Prilosec, Zegrid, Prevacid, Nexium, Dexilant, Protonix, and Acifex. Now these are, like I mentioned before, the gold standard, but it's very important that you take these medications appropriately. For the vast majority of the PPIs, or the proton pump inhibitors, you have to take it on an empty stomach, typically 30 to 60 minutes before your first meal or before dinner. The most common reason why people don't respond to these medications is that they either take it with meals or after meals. If you do that, you're not getting the full response of the acid-reducing medications. It's very, very, very important that you take this on an empty stomach, because if you don't, you're basically not taking medication to its full effect. Now, the reason these work very effectively is that they actually get to the root cause of why you're producing acid. You have these cells in the stomach that just produce acid and acid and acid. And what these acid-reducing medications do, or the PPIs, they actually block those cells so they don't work anymore, so you can't produce any acid. Now, a lot of people ask me, is there a major difference between these different PPIs? Is there a difference between Dexilant or Nexium? I can tell you objectively there is not. They all work the same. However, I will say that I have a number of patients who've told me they respond to one particular PPI versus another. So, for example, I've had a lot of patients who tell me they can't tolerate omeprazole, but they do very, very well with Dexilant, or they can't handle Nexium, they do very well with Acifex. And my answer to that is that there are some people who just metabolize the drug differently. And if you find that you want to try a different type of medication that's in that same class, go ahead. I think it's a very viable option to see your response and see how you do with that. So in summary, we have 3 main medical treatments for acid reflux. The first one includes the antacids, which are all very effective. They're safe, they're short-acting, but they typically can't control long-standing reflux. The next class are the H2 antagonists. They have a longer duration than acids, but they're not as effective as the proton pump inhibitors. But the good thing about the H2 antagonists is that they don't have the same side effects as the proton pump inhibitors. Then lastly, the gold standard are these proton pump inhibitors. They are the gold standard, they work the best, they're very effective to help out with your acid reflux symptoms. But it's very important that you take this on an empty stomach. If you take it after your meal or during your meal, it is not going to work. And these proton pump inhibitors have their own side effects, which I'm sure you've heard in the news about that. And so, in the next talk, I'm going to actually discuss what are the real side effects of these acid-reducing medications. Should you be worried about them? Are they worrisome enough for you to maybe stop these medications? What is real and what is not? Is there a really significant cause for stroke? What about your kidneys? Things like that. So I'm going to talk about this in the next lecture. And then lastly, we'll talk about some of the options, the new innovative options that we can do to help out with your acid reflux as well. So I want to thank you guys for watching this video. I would love to hear more what you have to say. Please feel free to contact me via Facebook, like my Facebook page, put some comments below. And keep in mind, I do this Facebook Live every Wednesday at 8:30 p.m. If you like these videos or you'd like to hear what I'm talking about, I would encourage you to visit my website and sign up for my newsletter. I'll put a link to my newsletter as well, so I can hear from you, and I would love to hear more about different things that you guys would like to hear me talk. But thanks and take care. I look forward to seeing you guys next Wednesday. Have a good night.